Hi, I'm Dr. Colleen Andruss. I'm a board-certified internal medicine physician. I'm also board-certified in the field of obesity medicine now for 25 years. I am also a coach in the Get Fit 21 program. So we are wellness coaches. We are life coaches. So to teach health and wellness to others, we must practice health and wellness. To teach health and wellness to others, we must also have knowledge, and knowledge is valuable. We must be valuable to those people who are coming in to these 21-day challenges. Now, the Mastermind team has created an awesome program and a wealth of knowledge for us through their daily emails, their educational tools, and they have made this a very nice turnkey system for us so that we are able to focus on what we really need to focus on. And even though we've got this turnkey system, don't ever forget why you're doing this. Okay, we are coaches. We are wellness coaches. We are trying to teach people, these challengers who come into this program with challenges. And we need to be there for them. So don't forget to be you. Don't forget to be there for them, despite all the wonderful things that the Mastermind team has done for us. So you must be there for them, and you must be able to listen to some of the issues that they might have and listen to some of the problems that they might encounter during this 21-day challenge. So I want to talk a little bit about how we handle that. I feel that one of the biggest issues that comes across in these challenges, as well as in my practice when people come in every couple of weeks to see me, Doctor, I've done everything. I have eaten exactly what I should be eating. I'm exercising. Why am I not losing weight? I think this is probably one of the most common comments that we as wellness coaches will get. Now, the very, very first thing we have to do is we have to hold these people accountable. And for them just posting their pictures, posting their shakes, their exercises, or making comments about what they're eating, that may not be enough for them. So the number one method of really looking into this and trying to figure out what's going on is to make them do a food diary. In the studies, food diaries are known to be the number one most effective method of success in losing weight, as long as they are still accountable to others. So whether that be on MyFitnessPal, or whether it be something that they record on a piece of paper that they email to you or just jot it in their emails, it doesn't matter. The power of the visibility and the vision of seeing what they are eating, and the people who are writing it down and actually looking at what they are writing down, the power of that is so much stronger than the power of just what we are saying. We live in a world of denial, and many times we either eat subconsciously without really realizing it, or we justify. We say, oh, this little bit won't hurt. Maybe those portion sizes are getting just a little bit too big. So don't hesitate to ask them to buy a scale or to weigh and measure things. Get out those measuring cups. Let's use some of these really simple tools that we have. So have them write everything down. Now, besides what they're eating and volume of food, we want to make sure that they're following our system. And our system is that 4-4-12 system. If you have them writing down their food, you're going to be able to tell whether they're following that system or not. So make sure that you're teaching them about the importance of 3 meals a day, not snacking in between, even if it's something healthy. Don't snack between meals. We lose the ability to burn fat when we do that. Also, we want to make sure that by looking at their food diary or MyFitnessPal that they're getting in adequate protein. I've already done a video on how much protein we should have. A minimum requirement is 90 grams of protein a day. If they're not getting in the adequate protein and they're high in carbs proportional to their protein, it's going to be very tough for them to lose weight. Why? Because carbohydrates stimulate insulin, and when insulin goes up, we stop burning fat. So by having them record and write down, again, whether it's by email or paper or MyFitnessPal, we can be looking at what they're eating. We can be looking at whether they're following the 4-4-12 system. We can also be looking at whether they're getting adequate protein in their diet. Then we've also got to look at exercise. You know, some people might think that walking to the mailbox is exercise. Well, you know what? I'm really busy during the day, so I'm getting in plenty of activity. No, you know what? You've got to bring your heart rate up. Now, for some people, walking to the mailbox might be exercise. If they've never exercised a day in their life, or if they're real heavy people, then that's okay. But for some people, we need more. And again, we justify and we think that what we are doing is okay. So have them write it down, have them record it. Not just take a picture of them exercising. Okay, they might just put on their workout clothes and take a picture, right? And it's not that we don't trust what they're saying, but we've got to make them accountable and hold them accountable in maybe a little bit more severe fashion than some of the others who are having more success. Now, we've covered the simple things. We've covered food diaries and making them accountable. Now that we know that they're doing the right things, they're eating the right things, they're not eating too much volume of food, so they're staying in a calorie deficit mode, they're getting in their protein, they're following that 4-4-12 system. They've got all that down. Now we got to start looking a little bit more into the nitty-gritty. So I want to talk real briefly about some medical things that we must think about. And, you know, some of these things that you'll be able to ask these difficult challengers about, but some of it might have to be referred on. Maybe you need to reach out to some of the coaches. Maybe you need to reach out to some of the physicians who are also coaches, such as me. But I think the number one medical thing we have to look at is, do they have metabolic syndrome? Do they have syndrome X? Hyperinsulinemia, insulin sensitivity. Their insulin levels are high. If your insulin levels are high, you're not going to lose weight. And whether we use a medication called metformin or we get them on the balance, if we don't bring those insulin levels down, it's going to be really tough for them to lose weight with nutrition alone and exercise alone. So we always must be thinking about syndrome X or metabolic syndrome. So they might have to go to their primary care docs. They might have to get an insulin level drawn and a hemoglobin A1C drawn to make sure that they don't have prediabetes or even diabetes. Second thing we have to look at is thyroid. Okay, thyroid hormone is something that is necessary for us to burn fat. And if somebody has an underactive thyroid, they can be eating absolutely perfect and exercising, and they're not going to lose weight. And they need to have an extensive evaluation of thyroid, not just the simple screening test that a lot of primary care physicians do. We need to know the details of the thyroid, the T3, the T4, and the TSH. Recommend that your patients have that test done, but they need all three, T3, T4, and a TSH. Then we have to look at maybe people are drinking their calories. Let's find out if they're having a glass of wine at the end of the day to relax. Are they having a few beers on the weekend because it's 115 degrees? So we never want to drink our calories. So alcohol is a refined carbohydrate. Alcohol stimulates insulin, and insulin, as you know, promotes fat. Then we have to look at stress. Maybe these people are having chronic, stressful situations in their life. I mean, we hate to put stress on everything as a reason or an excuse, but there are people who either have very high levels of stress or their bodies don't deal with stress very well. If our body is under stress, it raises our cortisol. Cortisol is our own body's steroid. And it's not necessarily a good steroid from a fat loss point of view. So if our cortisol levels are high because of chronic stress, we're not going to lose weight. There's actually a medical condition called Cushing's disease, where our body pumps out high levels of cortisol. Okay, those people are very overweight and have a very high fat content. So the other thing we have to look at, are they emotionally eating? Let's look at depression. Are these people on antidepressant medications? Are they going through some tough times? Are they eating emotionally? Maybe they need to seek some help. Maybe they need to be on some antidepressants, as long as they're not antidepressants that cause any weight gain. Which brings us to another issue for difficult challengers, and that is, are they on medications that may cause them weight gain or cause them the inability to lose weight? Antipsychotic medications, anti-seizure medications, some of the antidepressant medications, those are probably all the most common. We do have some great antidepressant medications that actually help with weight loss. Lexapro and Wellbutrin are the classics that are used in some of the eating disorder centers for emotional eating. And so obviously they don't cause weight gain. Other medications, beta blockers. Beta blockers are a very common medication for high blood pressure and heart disease. Okay, how many of these challengers are doing this challenge because they want to become healthier? They probably have some underlying medical condition. They might be on beta blockers. And yes, we have to weigh the risk and the benefit. It's not your job as coaches to take them off those medicines. But beta blockers will drop your calorie burning by 80 calories every single day. And that may not sound like a lot, but that adds up really fast. So if there is an alternative medication that these people can take, then you know what? They need to get on that and get off those beta blockers. Lastly, hormones, hormonal imbalances. Hormonal imbalances range everywhere from some puberty things to things that we see in the young adult. 5 million women in the United States are affected by something called polycystic ovarian syndrome. It's all about hormonal imbalance. Menopause, hormonal imbalance. Okay, estrogen, if somebody is estrogen dominant. Okay, estrogen is a fat storing hormone. So if somebody's having difficulties, and particularly if they are females, we must express some concern there and ask them to please get evaluated and have their hormones checked. In men, it's a testosterone issue, and that has actually been shown in studies. As men's testosterone levels lower, that it is harder and harder for them to lose the belly fat. So hormonal imbalance plays a huge role. And then there's some other more unusual things, lymphedema, lipedema, something that the Mayo Clinic has been studying. So we have a lot of underlying medical conditions. So for that challenger that comes to you and says, you know what, I'm doing everything, but I am not losing. Your job as a wellness coach is to help each and every one of these challengers be successful. And obviously success is different in every single person that's in this challenge group. But the greatest success that we will ever know is by helping others succeed and grow and feel some success in this particular 21-day challenge. So remember, we are wellness coaches. We must teach, live, and breathe health and wellness. This is an investment that these people have made. We don't want this to just be an expense for them. We want this to be an investment in their health, and we want this to be an investment in their life, so that at the end of their challenge, they can come to you and say, you know what, because of you and what you did as a coach, I didn't give up, and I feel successful.